Hi everyone, it's Branda with RadExam here. Today we have an excellent neuro case for you guys, so let's go ahead and get started. In this case, we have a 50-year-old male presenting with tinnitus and hearing loss in the left ear. An MRI of the brain with and without contrast was performed. The question in this case is what would be the most likely diagnosis? Would it be a meningioma, an epidermoid cyst, a schwannoma, or an arachnoid cyst? Here's a slightly more zoomed in look at the findings. If you want, go ahead and take a moment here to pause the video and come up with an answer, and then we can discuss it. In this case, the answer is C, schwannoma. This question is evaluating your knowledge on cerebellopontine angle masses. As a radiologist, it is an important skill to be able to give a good differential diagnosis when faced with an unknown entity, and location can be a great differentiator. However, in this case, all of these answer choices are reasonable considerations for a cerebellopontine angle mass. So how else can we further differentiate them? Well, let's take a look. We are given 3 axial images at the level of the cerebellopontine angle. There is a T1 pre-contrast image, a T2 image, and a T1 post-contrast image. The images demonstrate a T1 hypointense and T2 hyperintense lesion in the left cerebellopontine angle with avid enhancement. The intense enhancement rules out both epidermoid and arachnoid cysts, as they do not typically enhance. Also, if we look further, we see that the lesion is widening the porus acousticus and extending into the internal auditory canal. Coupled with a clinical history, this leaves schwannoma, or more specifically vestibular schwannoma, as the correct answer. Although meningiomas do avidly enhance, they often do not widen the internal auditory canal to the degree that schwannomas do. Meningiomas can also be seen to have a dural tail in some cases. Here is a few other example cases showing the other lesions. As mentioned, meningioma enhances, but doesn't invade to the degree that schwannomas do. This specific case of a meningioma can also be seen to demonstrate a dural tail. Arachnoid and epidermoid cysts will not enhance, as seen in these 2 top images. The best way to differentiate arachnoid cysts from epidermoid cysts would be to evaluate the DWI and ADC sequences. Epidermoid cysts demonstrate restricted diffusion and will be bright on DWI, as shown here, while arachnoid cysts do not, as shown on this image. Arachnoid cysts are also described as following CSF on all sequences. Another good teaching point to remember is that if you see bilateral schwannomas, think about neurofibromatosis type 2. Which can present with multiple schwannomas, meningiomas, and ependymomas. It's also good to keep in mind that often with test questions and with RadExam questions, they are looking for the best answer choice. It is often possible that other answer choices may present similarly, but are less likely. So always try to pick the best option given the imaging and clinical history that you are provided. Hope this was helpful in differentiating CP angle masses. Until next time.